Did you know that as many as 10% of newborn babies develop a fungal infection? Well, this statistic is a serious one. It highlights a common but often overlooked challenge in neonatal care. For parents and healthcare teams, understanding this threat is the first step toward protecting the most vulnerable among us. Knowing the signs, the causes, the available treatments is not just helpful, it is essential. Where do these potentially harmful fungi originate? The answer might surprise you. They are not always invaders from the outside world. Many of them are already living quietly on our skin inside our bodies. These microorganisms are known as commensal fungi. In a healthy adult, they rarely cause any trouble. However, in a newborn baby, especially one born prematurely or with other health issues, the story can be very different. The baby's developing immune system is not yet strong enough to keep these common fungi in check. This imbalance allows them to grow and cause disease, turning a harmless resident into a dangerous pathogen. Fungi that are part of the mother's natural microbiome can be passed to the baby during birth, on surfaces in the hospital, on medical equipment, on the hands of caregivers if proper hygiene is not followed. Because a newborn's skin is so thin and their immune system is immature, these fungi find an easy entry point. Understanding this transmission is critical for developing effective prevention strategies in neonatal intensive care units and at home. This hidden world of fungi presents a unique challenge. Unlike many bacterial infections, the initial signs of a fungal problem can be subtle and easily missed. Section 2. The usual suspects: identifying fungi and at-risk infants. Several species of fungi are commonly responsible for infections in newborns. The most frequent culprits belong to the genus Candida. Within this group, a few species stand out. Candida parapsilosis is a species that often lives on the skin of healthy people, including healthcare workers. Candida albicans. Candida tropicalis. These are frequently found in the gastrointestinal tract. These are frequently found in the mouth. While these fungi are typically harmless residents, they can become opportunistic pathogens in the right circumstances. They take advantage of a newborn's underdeveloped defenses to multiply and cause illness. Certain babies face a much higher risk of developing a fungal infection. Prematurity is the single most significant risk factor. Their skin is also thinner and more fragile. Low birth weight is another major risk factor, particularly for infants weighing less than 1,500 grams, about 3.3 pounds. These very small babies often require intensive medical care, which introduces other risks. Health complications in the mother, such as preeclampsia, can also contribute. A long hospital stay exposes the infant to a hospital environment where fungi may be present. Intravascular catheters create a direct pathway for fungi to enter the bloodstream. Long-term parenteral nutrition is also a well-established risk for fungal disease. Neonatal fungal infections generally fall into two main categories. The first and more common type is non-invasive candidiasis. This is a localized infection confined to a specific area, most often the skin, or the mouth. One form is called congenital cutaneous candidiasis. The infection can be present on the skin at birth, or appear within the first few days. The baby develops a distinct rash. The skin may appear red, raw, and scaly. Sometimes small pustules form, or blisters. The rash often appears in skin folds, the neck, the armpits, the diaper area. It can also cover the face, or the scalp. A skin infection is not as dangerous as a systemic one, but it still causes significant discomfort. The affected skin can be very itchy and sore. The infant may be unusually fussy, irritable, and difficult to soothe. An oral infection known as thrush is another form of non-invasive candidiasis. It shows white, cottage cheese-like patches on the tongue, the gums, and the inside of the cheeks. These patches can be painful and may interfere with feeding. The second, far more serious type is invasive candidiasis. It happens when the fungus breaks through the body's initial defenses and enters the bloodstream. Fungus in the blood is called candidemia. This is a medical emergency. The infection can spread from the blood to the brain, the heart, the kidneys, the liver, and the eyes, causing severe, potentially permanent damage. When a doctor suspects a fungal infection, they must act quickly to confirm the diagnosis. For invasive disease, the gold standard is a blood culture. A small sample of the baby's blood is taken, placed in a growth medium to encourage fungi. If Candida or another fungus grows, it confirms a bloodstream infection. The laboratory can identify the exact species and test which antifungals will be effective. For a skin infection, a simple swab is taken and examined under a microscope or cultured. For suspected invasive candidiasis, additional tests check spread. A urine culture checks the kidneys or bladder. A lumbar puncture collects cerebrospinal fluid. That fluid is tested for meningitis. An ultrasound of the heart, an echocardiogram, and an ultrasound of the kidneys may be ordered. Treatment for suspected invasive infection must begin immediately, often before lab confirmation. Antifungal drugs are the primary weapons. Fluconazole is one commonly used medication. Amphotericin B is a powerful, broad-spectrum antifungal. Echinocandins, such as micafungin, are also highly effective. Medication choice depends on several factors. The doctor considers the baby's age, weight, overall health, kidney function, and liver function. The Candida species and potential resistance are also critical. Treatment often lasts several weeks to eradicate infection from blood and organs. The team monitors effectiveness, watches for side effects, and adjusts the plan as needed. While we have effective treatments, preventing fungal infections in the first place is always the better course of action. Some risk factors, such as being born prematurely or at a very low birth weight, are not always preventable. However, we can take decisive steps to mitigate many other risks. This is especially true for broad-spectrum antibiotics, penicillins, cephalosporins, carbapenems, used only when clearly indicated. H2 blockers and proton pump inhibitors have been associated with increased risk. Use the shortest time possible.